Hello and welcome to the Curiosity and Consciousness podcast. The intention of this podcast is to open your mind, get curious about yourself and connect to the power you hold within. I am your host, Karen Maloney, an inside-out coach, helping you to believe in yourself and manifest your desires. Check out the podcast, available on all platforms, and go to my website, www.karenmaloney.com for all info. Hello, happy Thursday. The weeks don't be long, flying by. Here I am again with another podcast, another wonderful guest, and this week joining me is Dr. Dilis Clare, and Dr. Clare is a leading authority on herbal medicine in Europe. Her background in family medicine, combined with her clinical and academic credentials in herbal medicine, mean that you are assured of the highest level of medical care. Dr. Clare has been in full-time integrated medical care since 1999, and merging her extensive knowledge of herbal medicine and years of experience as a general practitioner, she brings a unique and tailored approach to her practice. This is an amazing conversation with Dr. Clare, who shares of her frustration in general practice or as a GP for 10 years and feeling under pressure to prescribe bags of drugs that she felt she didn't have time to fully research and that she may not even take herself. And gardening was her creativity, and one day something sparked when she was sitting in her garden looking around at the plants and the herbs that maybe she was meant to do something with them, that maybe they had some potential to heal and support people as well. And then it was a path of grace, as she calls it, that led her to studying herbal medicine and building it into her practice. And the most surprising thing of all when she started using the herbs was her patients got better, and that hadn't happened before in her general practice. She talks about how we have lost a lot of the connection with the herbs around us and their medicinal benefits, and she talks about regenerative medicine as well. She also gives some tips and herbs that are good for colds and flus, for long COVID, and anyone who is familiar with her shop on Sea Road in Galway knows she has lots of over-the-counter blends and remedies as well for all sorts of ailments, and she has them available on her website as well, which is www.drclareapothecary.com. That's DRClareapothecary.com, and she also has drclaresacademy.com, where she shares more information. But as always, I will have links from the show notes on my website, karenmaloney.com, and go to the podcast section. Enjoy. Hello, everybody. Welcome and thanks for joining for another episode. And I have the wonderful Dr. Dilis Clare joining me today. So I'm excited to connect, and thank you for joining and welcome as well.
Thank you for inviting me, Karen. It's always lovely to share and to share across waters and cultures and globally. And it's just lovely to be here and able to talk about herbs, my favourite subject.
Yay, I'm excited to delve in, and it is great, the ability to be able to connect globally, and you do such incredible work, and I'm sure within Ireland and maybe the UK, Europe, you're pretty well known, but to be able to connect across the waters as well and bring it to a wider audience, I think is just so amazing as well. And you are a medical herbalist and a GP as well, and what brought you to your love for herbs and to start tying that into your practice as well?
It's the most frequently asked question, and funnily, I seem to answer it different still 20 years later every time. Well, let's see what comes up today. Every time I went to the garden centre and checked out what was in the trolley, it was nearly always full of herbs. I'd been in general practice for about 10 years, loved my patients, loved the work that I did, but was getting more and more frustrated with my role of protecting people from unnecessary drugs that I wouldn't take myself or I wouldn't give to my children. And I wasn't alone, because I think something like GPs, children have 25% less antibiotics, and pharmacists' children have 50% less antibiotics. So I wasn't alone. I was trained by an excellent GP trainer in the middle 80s who said that most things get better in a week with antibiotics and 7 days without them. And yet the medical profession, it was well known, all the problems. It was well known, all the problems with Roaccutane. It was well known with all the problems of Ritalin. There was emerging evidence about the HRT, and yet nothing seemed to change. In fact, I was under more and more and more pressure to prescribe reams of shopping bags full of drugs that I would never really have time to properly review. So I felt that I wasn't being allowed or facilitated within the structure of medicine to do the job properly. So if I didn't give people drugs, what did I have to give them? When you go to the doctor, you want the doctor to say, yeah, I think you're sick, and here is something to make you better. That's universal. That's what we all want. I want something. I want to know you love me by giving me something that's going to really help and soothe and make things better. And we had drugs for very serious. I mean, if you have septicemia, you need antibiotics. If you have sinusitis, all the evidence shows that you probably would not benefit hugely from antibiotics. But medicine didn't seem to change practice. So I thought I knew colleagues of mine who had done acupuncture and homeopathy for the same reasons, but they weren't able to incorporate it into their general practice. So I thought I was being a bit clever by thinking, now I learn how to use some simple herbs that I can suggest to patients that have a reasonable basis. I couldn't use a placebo, that's unethical, but where there would be traditional evidence and some realistic basis for giving them this specific information based on my knowledge, which I would acquire. It didn't work out like that, Karen, because herbs are very complex. People are very complex. And you can't do it in a 5 or 7 minute consultation any more than you can with homeopathy or acupuncture. So I thought I was being a bit too clever, it has to be said. No, I haven't given that explanation for a while. But I think the other thing is I was living in England at the time, and my life in England was nothing but good things to say about it. A real meritocracy. As I say, the NHS meant I could treat people without charging them. Still something that charging them directly, still something I struggle with herbal medicine. And my family were growing up there. It had loads to offer, but it wasn't home. And that was because of the verbal culture. The mellifluence of speaking English in Ireland, right, is very different. You're probably familiar with this. We use the language in a very different way. And I was very homesick for it. And the herbal medicine soothed and eased that. It was even the Latin. I loved the Latin names. I loved the stories. We love telling stories in Ireland. And the herbalists that I met, once I committed to finding out more about the herbal medicines based on all that rational thinking, they were just good crack.
Very important.
And very very kind and very, very confident without any big show of medicine. You realize after a while is a lot of power play. And everything has to be monetized in a particular way. It's a particular mindset. That's what I'm saying. It's a culture and a mindset. And this was a very different one that really appealed to me and soothed my life, just made my life nice. And the other thing is my gardening was my creativity. It was the gardening that led me into the herbs and the garden centres. And one day I was sitting in my garden, my postage stamp garden in London. And I just sat back and I looked around me and I said, I think some of this stuff does something that I'm supposed to know about.
Amazing. Yeah.
So it was a real intuitive, And I was going to listen to the other side of my brain. See, I love science. And I love physiology. I love pharmacology. But I decided to follow that this would follow an intuitive part of creativity. The gardening was my creative outlet and my tuning down and tuning out. I mean, literally, I would go home after 2 surgeries of general practice, and whoever opened the door would literally give me a trowel and a cup of tea, unless it was latching raining, because that was my place to be myself.
Yeah.
Without demands. So all of them were leading to herbal medicine. So that was what happened. Yeah. And then they worked. I had no intention of changing my life. I was never sick, and herbs made me better. It was entirely serendipitous path of intuition. But it was the reason why I changed my practice, and I'm forever grateful that it facilitated my return to Ireland. And again, that was an intuitive thing, because I kept thinking, why do I want to go back to Ireland? My life is wonderful here. It's, I've got a great job, a great pension. The kids are all in schools and getting along and whatever. Why am I disrupting everybody? And it was the land and the speech, the poetic speech. And people said, you're crazy. And I said, I know. That was the awful part. I knew. But the clincher.
But at the end of the day, was it crazy, No,
not at all. Yeah. I've been happy out since. But it appears crazy by every
rational and logical thinking.
Yes, it wasn't. Yeah. So there's more to life than rational, logical thinking. That's for sure.
Wow. Yeah.
Oh yeah, but the clincher was, I actually got a grant from Maggie Thatcher to study herbal medicine. And the first science degree, BSc in herbal medicine, was in the college, the university around the corner from my general practice. And I got grants for 4 of the top herbalists in the UK to teach me in my general practice. By the time all that synchronicity happens, it would be churlish.
Yeah.
Now, I put in a lot of effort to make all that happen, but it all happened very organically. It started off with one step, and then another, and then another. So it was a path of grace. It was a green carpet, so I couldn't be so churlish that I wouldn't study it when all that was provided.
Yeah.
And then the awful thing happened. My patients came back better. These were my own general practice patients that I'd looked after for 10 years. And they came back time after time saying, I don't quite know how to put my finger on it, but I feel better. Now, they weren't doing that in my general practice clinics unless they were taking Colpramin or Spasmanol or something for their irritable bowel, but it still never got better. If they stopped the Colpramin or Buscopan, but the irritable bowel was still there. If they stopped putting the steroid creams on, the eczema was still there. And these patients were coming back and they were feeling better. And when we weaned off the herbs, they were better.
Wow.
And I this wasn't what I wanted to happen. And about 2 years for me to go, all right, I give in. They do work, right?
They do work.
And then about 6 months later, I kid you not, this was at the time when there was boxes and boxes of inkjet paper. And I was signing reams, a box and a half a day of these repeat prescriptions. Now, I'm not kidding you, shopping bags full of drugs. And I felt sick. It was actually literally a gut reaction. And I thought, I can't do this indefinitely. And that led to the choice of actually, becoming a herbalist in England or making the break and coming home to Ireland. And as my youngest was finishing primary school, we aimed to do it at that time, and it all happened in a very planned way. But so I have a lot to be grateful for personally. My personal story of healing was that when I was doing my general practice training, I actually got a very severe pneumonia and ended up in hospital for 10 days. After that, every time I got a chest infection, I would get wheezy, I'd be on antibiotics. And it got to the stage when the GP was giving me steroids, and I thought, hold on, this isn't the way it's supposed to be going. So I tried the herbal medicines. I thought, no, I'll give them I give them a job to do, right? See if
On
they do it.
yourself, yeah.
I haven't used an inhaler or a steroid, and I think once I've had to go to bed. One of the biggest ways of dealing with coughs, colds, flus, and chest infections is to go to bed. So I'd go to bed, take all the medicine, cancel my clinics, and 3 or 4 days later, it would either have passed me by or I'd have dealt with it without any drugs. So to me, that was kind of like I was joining in with my own patients, like despite my skepticism, total skepticism.
Yeah.
So that's a long explanation. Yeah.
No, but that's amazing. Thank you for sharing all of that. You touched on so many different things that, so many questions were popping into my head and different curiosities. But I really love how you shared just about how systemically the GP practice wasn't working, and it kind of came to that moral line within you of, I can't do this anymore. I just can't keep prescribing drugs and drugs and drugs and drugs. And
no, you see, the reason why it was an ethical dilemma was because I had done the degree in herbal medicine and I had other,
evidence.
It wouldn't be an ethical dilemma if I was only using the training that I got in medical school and postgraduate training and all the rest of it.
Yeah.
But because I had that opportunity, and it had been such a grace, unsought kind of beneficence that kind of tagged my life and kind of opened up all of these opportunities.
Yeah.
It was because of that. I mean, it's not that I think that medical practice as I practiced as a GP was unethical. It was in the knowledge that I had that there were other things I could use that were effective medicine, that were real medicine.
No, yeah. And yeah, I didn't mean that
Just
GP or
to
general
make sure.
practice is unethical, but I have spoken to other doctors and people, GPs, who also felt that way, though, even without, they eventually left and found other ways, but even without having something else to lean on at that time, they're just, like you said, they just saw the repeated patterns and people are not really getting better. So, on that side. But so much that you mentioned, and I love the intuitive part as well, and that battle between science and the intuitive, because I'm certainly a testament that I've trusted my intuition my whole life. And it's something that always seems scary because you never have the information beforehand, but it takes that, okay, I need to explore and trust, but then the synchronicities and how it all works out is just mind-blowing. So that's the bravery part as well, to actually follow that. And I love how you mentioned that it did happen kind of organically and under grace, and you have all this gratitude, and that's absolutely amazing. And then,
so do you want to give us an example of one of yours?
Oh God!
Just so that I know I'm not alone in being crazy.
No, oh my God! Well, so many, and even the fact I'm here in Mexico again, like that is from the very first time I came here in 2006. It was totally serendipitous. I studied Spanish in university. I had just decided to study it because I was always freezing in Ireland. And I remember the first time we went on a family holiday abroad, I was like 10 or 11. And for the 2 weeks, I just lived in my swimming togs and I was so hot. And I remember one day turning to Mom and I was like, Mom, what language do they speak here? And she said Spanish. And I was like, I'm going to learn Spanish. And I never, ever, ever, ever thought of that moment again till I was looking at my CAO forms and it just dropped in. And I was like, oh, it's something. So I started that. And then that's what brought me to Mexico. Again, when I came to the end of my 4 years, I was like, God, I actually really loved Spanish. And I'd spent a year in Spain. And it was like, what do I do now? Because I didn't want any kind of career back then. And I also felt it wasn't Spain. And I got this email in my college inbox, I have no idea who from, about teaching English in Mexico. And I was like, oh, that's a new country. They speak Spanish. And that's what first brought me here. And I always loved it, but I had no intention of moving here or living here. But just at the end of 2019, it was all up in my energy. It was like, I need to move to Mexico now. And I only booked my flights January 2020. And I was looking at dates like May, June, July, because I was like, okay, I know I need to go, but I still have the human mind that's like, you're insane. What the hell are you doing? Why are you going to Mexico? Where's this coming from? This is mad, But I knew the feeling and I knew to trust. So yeah, when I was booking my flights January 2020, I just kept hearing this voice. It was like, it has to be January or February. It has to be January or February.
Wow.
And I was like, okay. So I booked my flights. I left like 3 weeks later, maybe. And I knew it wasn't just a holiday, but I also had no idea how long I'd be here for. So I was saying goodbye to everyone going, I could be back in a month, I could be back in 2, I could be back in 6, I could be back in 10 years. Like, I don't know.
Yeah,
And yeah,
very
over
good.
2.5 years,
Yeah.
nearly 3 years now. And I'm so grateful. And like you said, how everything just worked out, because again, when I was coming, I didn't know for how long, so I didn't look into anything other than the tourist visa. You get 6 months, but then during the pandemic, they gave everyone automatically another 6 months. And then during the pandemic still, they came up with a program for people who wanted to stay in the country to get their residency. So again, it just boom, 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 like all worked
Wow.
out. So many,
Great.
so many.
Thanks for sharing.
Thank you for asking. But then what are some of the most common ailments as well that you saw presenting in GP practice, and also maybe in your herbal medicine practice as well? And what are the
Okay.
differences in, how they're treated? And
Yeah. It's a great question, because the things that I find so satisfactory to work with are children who have constipation, children who have poor and fussy eating, children who have recurrent infections, children who are unsettled, restless children who can't sleep, or who are oversensitive to worries. So recurrent infections and constipation of those would be the commonest. So lovely and easy and simple to treat with herbal medicines. For older people, again, constipation, diverticulosis, bowel disturbances of all kinds, gastritis, heartburn, all the digestive illnesses that come with the very young and seniors, because they respond so well. Like, for instance, a lot of elderly people who have constipation, if you use the drugs, they go between constipation and the runs. And it's so hard to get that balance between, do they take one tablet or 5 mils, or 2 tablets or 10 mils of the laxative that makes them go too much. And it's so difficult. With the herbs, so beautiful. The people who tend to come and see us are people with chronic Lyme, ME, post-COVID, cancer, and cancer when it recurs, like the very late stage ME, not the long COVID, that's not late stage, but a lot of people who have had trouble for many years with very entrenched energy, pain, problems. And we really want to see people at the beginning. So if you're having long COVID, don't wait until you've had it for 9 months or a year. Go and see a herbalist very, very early on if you're just not recovering very well. And they're not the most appropriate people to see with herbal medicine. We can still help. Everything can be adjusted, but the ideal patient for herbal medicine is the mild asthma, mild eczema, mild autoimmune disease or early autoimmune disease, early blood pressure problems, early mild to moderate, early mild to moderate, early mild to moderate. Because that's kind of like the general practice of herbal medicine. Seeing people with cancer, and we don't treat cancer, we treat people who are experiencing cancer, if you know what I mean. So the cancer might be causing constipation, it might be causing low energy, it might be causing, I don't think it wouldn't be ethical to say that you have a treatment for cancer, but certainly we see people with chronic autoimmune diseases. They often have minor symptoms which drive people crazy. They might have ME or might have MS, but it's the spasms in their muscles that mean that they can't sleep at night. So the herbs could be very good for helping with constipation and spasms. So it's not that you're never treating the named disease. You're treating the person who presents with that particular onslaught to their balance. And this is where it comes to my love of physiology. It's the balance in physiology, the balance in, energy out, and the balance in the spark. How strong is the vital spirit of energy, which is between the heart. It really amuses me that the medical profession has just discovered how central and core the digestive system is only in the last 5 years, whereas every indigenous practice of natural holistic herbal medicine and other modalities like acupuncture have known that in every culture of medicine and practice of medicine all over the world, whether you're in Tibet or New Zealand or Mexico, they all follow universal principles of understanding. They might apply things in different ways and they might use different language, but they are the core principles. And the truth of the matter is that it's actually the heart that's the heart of your health. And the heart is where you have your electric stimulus to stay alive, beat by beat, minute by minute, hour by hour, day by day, 7 days a week, 24 hours a day. So it's the electricity that gives you the vibration and the frequency and the energy. So for that reason, I call what I do with the herbal medicine an energetic system of medicine.
Mm.
And we can break that down then to show how the individual constituents, the ones that we know of, and the knowledge that we do have, we can see how that would fit in with supporting normal function of digestion, hormones, elimination, all of that kind of thing, in order to support that vital energy. That's my taking of it. Every herbalist will give you a different one.
Yeah. No, I love that. It's funny. I was actually reading something recently about the heart. Obviously, it's pumping. It's literally keeping us alive. But it's the bigger question of, but what is making the heart pump?
Yeah.
And that's a whole other conversation and rabbit hole to go down. But I love what you said there as well. And, I think that's one of the big things that conventional medicine does. It does treat the disease and the symptoms. And it's like a sticky plaster approach. It's not really getting to the bigger picture of what's going on. And like you mentioned earlier, in that 5 to 7 minute consult, like what else can you do? And I also think we've been taught this kind of learned helplessness of, no, you need to fix me. You need to sort me out, without being accountable for ourselves as well. So can you just talk on that for a minute as well? Like the bigger picture of actually what is happening in the body when an illness or something presents?
Well, I'll take it from a slightly different thing, which is when you go and see a herbalist, you don't go to the herbalist for the herbalist to fix you. You go with an intention and a curiosity and a willingness to comply with treatment. Because people have a vague notion. Your herbalists they're nice, they're good people, they're the good guys. Mm-hmm. They use harmless stuff. Yeah. It's not real, so it doesn't really matter if I miss a few doses,
Yeah.
And just by going, I'll get a blanket, something or other, I don't know. When people go to the doctor and they tell them that a number in their blood is unusual from their perspective, which would be cholesterol, and the doctor says you'll have to take these tablets, statins, for the rest of your life, and patients go, okay. Yet they go to a herbalist. Like, that's another 35 years of statins. But many people go to the herbalist and they say, how long do you think it'll take to treat? Now, if you have something like underlying multiple sclerosis or cancer or autoimmune disease, the answer is probably forever, but at least 2 years. And they go, 2 years? Really? I'm going, really.
Really? Better than 35, 40.
Yeah. And people expect to have to they would need to keep going back to their doctor over the next 35 years, but they expect to see the herbalist for a set of symptoms like chronic sinusitis. Actually, herbs are very good for chronic sinusitis and irritable bowel syndrome. So they see people for chronic sinusitis, and they've been using the drugs, the antibiotics and the nasal sprays, they've been using them for 25 years. But they expect the herbalist to cure it in 3 months so that they wouldn't ever have to see the herbalist again.
Mm-hmm. Yeah.
So it's about managing expectations, but an intention, a curiosity, a willingness to change something in their lives because they're doing something which is aggravating their normal homeodynamics. I don't call anything homeostasis because nothing stays the same. Nothing is static. So I use the term homeodynamics. I'm not sure I answered your question, Karen. Can you remember what it was?
Just the bigger picture of what's going on in the body when illness does present.
Okay, that's another. They're great questions. I say to people, your symptoms are your friends. Don't complain about your symptoms. Think of it and be grateful for your symptoms. If you have, there's a great herbalist in England who has passed away since, Christopher Headley, and he said anybody who has eczema has a big advantage in life because they get itchy, blistering skin to show that their homeostasis is out of tune, and they should address it Often people will go, I know exactly what it is. I'm not going to bed before 12. I'm not drinking enough water, and somebody is getting under my skin, and I need to sort it out, literally.
Mm-hmm. Yeah.
So your any symptoms are your friends. Many people are built like a tank. They never have any illnesses. It's like they just keep going, and they're often the people who can keel over suddenly, right?
Yeah.
The type A personality who is all up there, everything is, they're running and doing all kinds of things, and they can keel over. So
I
your
love that.
symptoms are your friends,
Yeah.
but not symptoms that are so debilitating that you can't live your life. That means that if you're having symptoms that are so debilitating, they're really affecting your daily life. A herbalist that's at least 6 to 12 months realistically. Um,
Yeah.
so go along with that and budget along with that expectation.
Yeah, love that. And that is the truth. And I see it as well as like a coach in helping people with their mindset and changing their habits.
Mm.
People have been living a certain way or feeling a certain way like that often for decades. And they
Mm-hmm.
don't want to give themselves the gift of 6 months, a year to feel totally different. It's like, what? It's not going to be instant. And it's like,
Yes.
well, the way you started living didn't happen instantly either, but it's just
Yeah.
been repetitive and repetitive and repetitive that it just feels so normal. So I love that's a very apt analogy as well. And I love that symptoms are your friends as well. And I've certainly changed my approach because I lost my dad to cancer 11 years ago. And initially, and after seeing what he went through and the conventional route, I was like, if that ever happened to me, just put me down. I don't want to know. I don't want to try. Absolutely
Oh,
not doing that.
yeah.
And it's funny because it's funny, it's not funny, but the fear that goes into people when they're given a cancer diagnosis, and I don't believe in giving diagnoses per se and like certain amounts of time, because it's been shown again and again how people believe that, and
Mm-hmm.
then it becomes a truth. And I know even my dad, he wanted to try other things, but he literally felt like he had no time. He's like, no, but like I have to go in for this, that, and the other. But
Mm.
now, after doing my whole delve and everything as well and learning more about the body, I'm like, actually, no, it's not a death sentence. It's really your body talking to you going, hey, there's a lot of things out of alignment here. I really need your help now. I really need your input. We really need to change some things. And, that's my view on kind of health in general. It's your body is incredible and it's always talking to us, but we just
Yeah.
don't know how to be in communication. And often we just go straight to, oh, it's letting me down. It's given up on me. And it's like, no, it's not at all.
Being
Um,
unwell is normal.
yeah,
It's your body readjusting.
yeah.
If you were in doing a talk for 100 people and you said, hands up anybody who's never been sick, nobody would put their hands up.
Mm-hmm. Yeah, I agree. Yeah.
So it's a different way of thinking about it. And herbs are, I encourage people to use herbs in their cooking, the thyme and the sage. You know that they're antimicrobial. So this winter, lots of thyme and sage. We know they were proven scientifically in empirical science at a time when there was no refrigeration, and you would kill your deer or your lamb or whatever on a Monday and you'd still be eating it on Wednesday. And you would very quickly learn that if you wrap your meat in thyme or sage, or a combination of the two, along with some onion, a lot fewer of your family would be out in the outhouse, and there was no ensuite toilets with diarrhea. So we didn't learn to put sage and thyme in our food because they taste good. We put them in because they're medicinal. They're antiseptic, antibiotic, and if we put them in our food all winter along with garlic, we're actually using herbal medicines. If we put ginger in our food and nigella seeds, we can help prevent viral infections. If we use garlic on a regular basis, and if we rub garlic into children's feet when they're getting a cold, it's a good way of treating them. So there's all kinds of ways. The problem for herbal medicine is that we've lost our home herbal, where people know how to go from A to B for all of the usual things. They then prove in the home that the herbs work, and they know when to go and see a herbalist because they know they work this far, but then I need professional advice.
Mm-hmm.
But we've
Yeah.
lost that layer. In Ireland, particularly, it's a colonial story because we very quickly wanted to lose connection with what poor people had. We wanted what was in the big house, because we never had an industrial class. We never had the esquires. We never had, there's a whole middle section. So we went from poor to educated. And we educated ourselves out of valuing things that were close to the land.
Wow. That's so interesting you said that,
Yeah.
because, living in Mexico, I see things so differently. Like the GP practices are empty. You can walk in there anytime, day or night. There may or may not be a person before you. And that's because they're drinking teas. They're making their own concoctions at home.
Right.
They're close to the land. Like, everyone knows about different herbs for different teas. They're available in all restaurants. They know paleo for, after dinner, or like, it's just so incredible. And then I hear friends at home that they're waiting 3 weeks to get an appointment in the GP. And I'm like, it's just that exact thing of, we've lost so much of the knowledge that's around us. Like you mentioned towards the beginning of the story, when you were sitting looking at the things in your garden going, surely they can help me in some way, And yes, there is a time when everyone needs professional help, but like you're saying, those knowing even what's native and indigenous around you and using it in cooking or using it in teas or whatever it is, there are benefits, and for such a developed but a poor country as well. Like, there's so much poverty in Mexico, but I just see a different health system. And again, there's positives and negatives to everything.
Absolutely.
It's not saying it's perfect, no, by no means, but it's really interesting to me.
That's a very good point, that it's different over there. It's different everywhere. But health, absence of health, and diseases suffered by populations vary from era to era and from locality to locality. But the evidence of the current medical system is one of increasing disease, which is not being addressed on any kind of a public investment. The only investment which cannot be questioned by anybody at any time is the budget to buy drugs. That is elastic. And if anybody suggests that we shouldn't be able to use a particular drug, there's outcry. So there's a complete imbalance. Medicine and health are so complex, but there's only one solution allowed and budgeted for in public health. That was the point I'm making. So you can pay your taxes, you can pay your private insurance, but none of them will actually facilitate or give you any comeback if you use holistic medical practice of any kind. So you're paying three times over, and there is no. The cosmology is one of evidence-based medicine, and I think that should be evidence-influenced medicine, and it should be as was intended by the doctors who first proposed the evidence-based medicine model, that it be put into place in accordance with the patient's beliefs. And that last bit has been dropped from the storybook. So we live according to stories, and the story is that every medicine has to be quantifiable and testable by a randomized controlled clinical trial. I can tell you that that model is totally unsuitable for the complexity of herbal medicine, because each herb has about 350 constituents. A blend of herbs would typically have about 5 to 7 herbs. And then you have the complexity of each individual human body. And the one-to-one consultation matches the complexity of the herbs to the complexity of that individual. That's why it can't be done in 10 minutes. This is personalized medicine. And it's an art. It's an art which is backed up by all of the science that's available. There's an Empire State Building worth of evidence, life sciences and clinical evidence, that these herbs have real medicinal value. And of course, 60% of drugs are based on extracts from herbs. How did they know to look at those actions? Because of the empirical knowledge of the herbalists, whose knowledge they often stole as intellectual property. I mean, particularly from countries like Mexico, Brazil, Maori, the First Nations of North America. This was all contextualized. And now all of the research that's being done validates the effectiveness of the herbal medicine, but it's being done in order to raid the piggy bank. They promote turmeric as being not bioavailable as the whole herb. And I'm thinking, I worked with a lot of Asian doctors when I was in hospital practice in England, and they all use the turmeric for their flus and coughs and colds in their ghee. And they learned that from their mothers and their grandmothers, and it worked. And it's been proven to work. It's got 5 different ways. It's anti-cancer, it's anti-infection, it's antioxidant. It's got all of the science behind it, but they say it's not bioavailable. Bioavailability is limited to how much is in the blood after 20 minutes. That's an extremely narrow definition of how much herb would be useful within the complexity of human physiology, because it doesn't account for the effect of the turmeric on the gut microbiome. It doesn't account for the metabolites of the turmeric. It doesn't account for the compounds that are absorbed directly across the digestive wall. It doesn't account for the herb constituents that are absorbed into the lacteals of the lymph system. So do you see how the complexity of the herbs matches the complexity of the humans that we co-evolved with and have thousands and thousands of years of empirical knowledge, of intense study. All the cosmologies and explanations might vary, but there is an enormous amount of consistency within the practices within all these individual indigenous groups. And then lots of intermixing. None of it is pure. There's intermixing. The Western herbal medicine practice has a lot in common with Unani Tib medicine in Asia, because they both originated from Syria, Egypt, Greece, Rome. One branch of it went up into Asia and another branch went up into Western Europe. And we then have a whole Druidic tradition. And herbs and medicine and healing have always had a spiritual aspect up until the last 300 years. And to mention spirituality in today's medicine is,
insane. For the birds.
Given that we've medicalized birth and death, that are both spiritual experiences from the widest interpretation.
Absolutely.
I can't see how we can't be influenced by, and seeing how people cope with illness and dying and death and birth. There's an aspect to it that's non-quantifiable by numerical measurement. And we have a current cosmology which is about counting. If it's not countable, it's not real. That's the cosmology. And it leads to scientism, which drives us scientists mad. Because I love science. I think it's great to have another branch of information.
Yeah.
But the only thing that's studied in that way has to be monetizable.
Yeah.
So
and that's a whole other rabbit hole of, why? Because again, like you mentioned, they're trying to replicate a lot of these molecules that exist in nature into pharmaceuticals. Like that's what they're trying to do, to patent it. And that's a whole other conversation of why, and a deep rabbit hole of conspiracy theories and all sorts. But there's a lot of evidence as well to be like showing the truth. And but I love that in any kind of holistic approach, it is that more personalized approach, because we are complex. Like you're talking about, herbs are complex. And it's a dance between and that energetics and the spiritual as well. Because I think science is incredible and I love science, but also science is limited by the people driving it and this existence. Who knows? They're still trying to measure it, but that doesn't mean that it's not true and it doesn't exist. Sorry, go on.
One other, if you want to talk about regenerative medicine. See, I think that, medicine, again, you can use plastic, you can invent chemicals that's just washed out into the general sewage system. I mean, the amount of perishable plastic goods, because they won't pay for staff to sterilize things. So not all of it is necessary. Some of it is necessary, of course. But the wanton and unaccountability is what I would be speaking up for, because I like to speak up for things rather than it kind of be critical. It's kind of, we need to pay attention. So on the other hand, so regenerative goes beyond sustainable. It's actually, can we put more back into the system than we're taking out? And I would say that herbal medicine, it increases biodiversity. It aids rural communities by providing purposeful use of the land, in a way which is not highly nitrogenous monocultural farming like silage, which drains into the water system. So it increases rural development and sustainability. There's lots of other things in there as well, but you get my drift. That
Yeah.
you're going towards a positive contribution to carbon. Okay, that's the other one is the carbon. It keeps plants in the ground. It helps wildlife. It brings back hedgerows. It's a
Like you
winner
say,
all around.
yeah, and
Yeah.
it's bringing the bigger conversation as well, and connecting back to that higher perspective and consciousness as well of, the whole system, because we are all interconnected, we are all one, and we're one ecosystem as well. So it all has an effect on ourselves and the planet and the environment around
Ah,
us. So I think that bigger conversation is so
yeah.
important. And this is such a fascinating conversation, and I know we're kind of going a little over the usual time, but it's so interesting. And I want to touch on as well before we finish up about how herbs as well can help, with coming into flu season now as well, coming
Oh,
over
yeah.
into the winter, and even with mental health, and especially after the pandemic and the crisis that we've been through, can they
Okay.
help as well with people with
Yeah.
anxiety and things like that as well?
There's in a pile in front of me here, but it'll take me a few minutes to find it. There's one scientific article written by 25 international pharmacologists, um, describing, I think it was something like 37 herbs, of which 12 were clinically defined as based on clinical evidence, likely to be useful. Another 21 were traditionally used and supported by life sciences, like physiological probabilities based on in vivo or in vitro studies and what we know of how physiology works. And another 12 were traditionally used, no evidence, no science has been done, but they were traditionally used and known to not have any safety concerns. All of them were safer than paracetamol or ibuprofen,
Wow.
which have significant harm. We all know some of them. They're the thyme, the sage, the cloves, the garlic cloves, and cloves. Steaming with turmeric and cloves is very good for disinfecting your nasal passages. Keeping hydrated, keeping warm. Vitamin D for prevention of COVID. A teaspoon of nigella seeds daily. Use turmeric in your food, and then lots of herbs. If people go on my website, they'll be in the mucotone, and we also have a specific blend of herbs called Covitone, which it's not on the website, but people can phone and ask about, because I know your time is very short. So, the echinaceas, not ashwagandha, though that would be very good for us all being stressed as well. Andrographis is the other one I was thinking of. Lots of herbs that are detoxing. Stay off the sugar this autumn, guys. It really winds up the immune system. The prolonged COVID is a problem of the immune system. It's not a problem. It's not a viral problem. This seems to have a more sustained impact on the immune system, which is why it can be more prolonged. And I mean, I'll just say the current situation about the menopause is one that people who aren't taking HRT are in the minority and are under pressure to take it from well-meaning friends and whatever. Ironically, I've been prescribing HRT for the last 20 years when other doctors have shunned it completely. I've always felt it was useful, but I don't think every second woman needs it. And they don't need it just in case, and they don't need it to maintain bone strength, and they don't need it to maintain their muscles, and they don't need it for all kinds of things and for mental health. There are lots of other strategies, including St. John's wort. And again, St. John's wort was put forward as being contraindicated with a number of drugs. That isn't the case. It's when the constituent hyperforin is exaggerated by commercial products, where they add extra hyperforin that causes the problems. So long as the product that you're using has less than 1 milligram of hyperforin per day, it doesn't interfere with other medication. But if you're on any drugs with a narrow therapeutic index, and your pharmacist will let you know, or your doctor, or if you're on complex heart medication or medication for cancer or anything beyond like an allergy tablets or whatever, you need to see a herbalist if you're considering taking a significant amount of non-food medicinal herbs.
Wow. So
That was a long
interesting.
sentence, Karen. Sorry about that.
It's so interesting. And when you mentioned HRT as well, so because menopause and perimenopause is such a prevalent thing as well that women go through, and are there lots of different herbs in that can help with that process and the hormonal balance without having to go maybe the HRT route? If that's
again, we have a blend for over the counter for most mild to moderate symptoms. If you're having persistent problems, make an appointment for a medical herbalist. And it might be that HRT is indicated for very severe problems for a period of time. But are you still going to be taking HRT when you're 65, 70? At some stage, you have to drop the HRT, and then you go into the same perimenopausal. And I've heard doctors say that this doesn't happen, but I certainly have witnessed it, and I've searched the research, and there's no evidence that when you stop HRT, you don't go through the same problems that you went in to delay the symptoms. And that's a very important thing. So I'm seeing people like 12 years later. The risk of breast cancer is still there. If you look up the NHS HRT side effects, you will get the same list of effects that were there before the current massive marketing of HRT. And doctors are under huge pressure to prescribe it. Like doctors who feel that it's not the only solution, or it's a normal transition. They're feeling under huge pressure to prescribe it.
Yeah. And where does that pressure come from? Because you mentioned that before as well. You felt very under pressure to prescribe bags of drugs.
Marketing. And many of the self-help groups, patient self-help groups, are actually funded by the pharmaceutical industry.
Interesting.
I mean, I don't believe in conspiracy theories. That's actually what is happening.
Yeah. No, but that's what people call them. They call them conspiracy theories to try to throw people
not.
off. And you're like, no, there's lots of facts and truth.
Yes, this is not controversial. Yeah.
And just before we wrap up as well, you do have loads of over-the-counter remedies and teas and all sorts that are available. Are you still on Sea Road?
We are, yeah.
Yeah, Sea Road, and in health food shops. I've seen them in health food shops around the country as well. So,
and pharmacies.
What led you to creating these products as well for people?
That was when I came and opened up the clinic. People came in and said, "Do you have anything for a chesty cough, or do you have anything for my hay fever, or do you have anything for my PMS?" And the staff weren't herbalists; they were receptionists and general assistants, and they were trained to make up the individual blends. So I made up some stock blends based on very well-established principles. I wasn't going this. I have no new knowledge. All of the awards go to the herbs, right? I'm just a facilitator. So I gradually built up this, chest infections and sinuses and acne rosacea as well, and hormone balance and detoxing and hormone regulation. Anyway, so people would come in, so the staff would dispense them according to the patient's, the customer's requests. And a patient of mine came in and saw that this was what we were doing. She said, you should put labels on them. And I said, yeah, I think I should. Yeah, that'd be a good idea. 6 months later, did you get those labels done?
Yeah.
I'm completely technophobe. I'd much rather talk to people.
Yeah.
So a few months later, she came in with the labels and said, there you go, on a floppy disk. So they were entirely generic. And then a pharmacist asked if they could stock them. And we said, yeah, no reason why not. And then gradually the word went around there. There are people who have come to us because people have to want to sell them. They want to be interested. They need to be interested in what they can do. And there are very often people who themselves have experienced the benefits. Because once you realize that herbs are real medicine, you don't go backwards. It's all going forwards, and then you learn a bit more and a bit more, and then you kind of go, oh no, I'll have a ginger tea today, kind of. And but the next thing you know, you have a first aid kit.
Yeah.
Where you go, and that's and then you go, oh, I don't have anything for this, so you find out a little bit more, and that's what happens. And there's fabulous teaching on the on YouTube. You need to know where to go. Rosalie de la Forêt has very good introductory herbal courses that are free, and I teach for Heartwood, which is a professional herbal medicine course, which is excellent. But they do a foundation course, which there's a fee for it, but it's absolutely brilliant. That's Heartwood, HEARTWOOD.co.uk, I think.
Brilliant. I'll look that up and I'll link that as well. And, I love that. They are real medicine. And as you say, I think that's it in life, even with about ourselves, when we have a little bit of curiosity and we do want to open our minds a little, you are led and you find such magic and incredibleness. So thank you so much for sharing today as well. I've thoroughly enjoyed it. I could have asked 1,000,001 more questions. Maybe we'll have to do another one at some stage. But please share where people can find out more about your work as well.
Yes, well, it's Dr. Dilis Clare, Dr. Clare's Apothecary, and we're on Facebook, and that'll be linked below, won't it?
Yeah.
And we're in Galway on the Wild Atlantic Way. If you need a reason to come to Galway, we can be it. It's a fabulous place to visit. I think that's it, is it?
Yeah, brilliant. And like that, I will link them as well on the show notes on my website. But thank you so much again, Dr. Dilis, for joining and sharing some of your wisdom today. I've thoroughly enjoyed it. So thank you.
Good. I'm delighted and very happy to join you and talk to you. Thanks a million.
Thanks for listening. And before you go, I would love to ask you a massive favor. If you enjoyed this episode or any episode of the podcast, I would love for you to leave a short review on Apple Podcasts to help it grow. If you could do that, I would greatly appreciate it.